Andrew, former reporter with the Santa Fe New Mexican, and before that, the Taos News. You're with the Arizona Republic right now. Welcome back. It's really great to see you. President Trump came to Arizona this week. As you have reported, this was his third visit in 5 months. Why was he in the state, and who was there to listen to him?
Arizona is obviously going to be a battleground in November, right? And the president has work to do here in terms of winning back voters. We've seen Joe Biden leading in Arizona in recent polls. And so, on top of that, the president has spent the last several months, right, mostly on defense about issues that he's really not, I think, in a lot of ways necessarily comfortable talking about. You've had the coronavirus, you've had nationwide protests against racism, police brutality specifically. Those aren't really his issues. And so I think that coming back to Arizona was a way for him to try to refocus his campaign, try to make it look more like the campaign of 2016, visit the border, have this sort of large crowd, speak to them about many of the same things he would have spoken to them about 4 years ago. I think it was an attempt to really kind of refocus things and put them back on his terms.
You and your colleagues have been reporting on Arizona's rising COVID-19 numbers, hospitalizations, cases, all on the rise. What happened in Arizona?
Yeah, we've seen new records every day for the number of people hospitalized and in hospitals with the coronavirus. We see rising numbers of cases. That we've really seen public health officials who a month ago were, at least state officials, trying to sell the end of a stay-at-home order as something timely and something that the state could handle, to really trying to, I think, punch the brakes right now and urge caution. Arizona had a stay-at-home order in effect from I believe it was late March through mid-May. And, it was fairly permissive, I think, not just legally. It did have a day-to-day effect. You didn't have people crowding into restaurants, big events were canceled, things like that. But I think there was also a muddled message about what exactly the point of the order was. It was called Stay Home, Stay Healthy, Stay Connected. But what were people, I think a lot of people had questions about, well, does everyone need to be worried? Is it older people who need to be worried? Is it people who are immune compromised who need to be worried? Should we all just stay home? Is it okay if I go do this or go do that? I think the state really muddled the message at the outset. And then when support began to fall apart politically for this approach, we have a Republican governor. He faced a really kind of internal revolt within his own party over this. He ended up lifting it in mid-May, I think, under a lot of pressure. And since then, again, I think we've just had a lot of confusion among people of, well, what exactly is the threat here? And I think that's only been compounded by political leaders who have sought to downplay this altogether, who have suggested that COVID-19 isn't really a problem or isn't something that people need to worry about. I think the public's just been rightly confused by a lot of people that they would ordinarily look to for clarity on this.
Right. So let's talk about testing. How easy is it to get a test if you need one or want one in Arizona?
I saw when New Mexico was rolling out drive-through testing. I don't think we had anything like that yet in Arizona at that point. We were slow to get initiatives like that going. The state has since ramped up testing, but it kind of depends how it goes. Kind of depends on who you ask. I've heard from some people who said, they got an appointment at a clinic, showed up, were in and out in 10 minutes. I have a friend of mine who sat in line for 13 hours waiting to get a test. And that was in an area that is, underserved as it is, a predominantly Latino neighborhood. So I think it kind of depends where you are. I think it depends on the resources that you have. And I think the state has certainly been slow to ramp up this process.
So in terms of looking at who has really been affected by COVID-19, are there specific pockets or parts of the state or populations? What's happening with that?
Yeah, similar to New Mexico, we saw really some of the hardest hit areas at first, on the Navajo Nation. Now we have seen cases really increasing in Maricopa County, our big urban center, Phoenix and its suburbs. We've also seen cases increasing along the border in border communities like Nogales. So we're seeing kind of different areas affected at different times, but I think that there is uh, kind of a theme that we've seen across the country where, you're seeing a lot of cases among people who maybe they have jobs where they can't work from home. They're service industry workers, they're frontline workers, or you're seeing increases in cases where maybe housing isn't as readily available and as adequate as it should be. So you're definitely seeing, I think, the brunt of this fall on communities that are already underserved.
Local governments and certainly universities in Arizona have made some pretty big cuts. You reported recently that the state budget doesn't look as bad as maybe lawmakers had feared. Can you talk a little bit about the budget and what legislators are expecting over the coming months, maybe?
Yeah, so we went from expecting at least about $1 billion shortfall between this fiscal year and the next fiscal year to maybe around $700 million. That's nothing. That's not good, but we're looking at problems that I think state policymakers think that they can handle at least in the short term without making big cuts. And a lot of that stems from Arizona's tax base, right? We've seen things like retail taxes and some sectors of retail haven't really fallen off as much. People are still going to the grocery store, right? Where we have seen revenue really decline is in areas like tourism. This hit at a time of year when it's actually a very pleasant time to visit Phoenix. And a lot of people were canceling conferences, canceling big events, and that certainly took a hit. National parks, I'm sure this summer will be quieter. But Arizona is not a resource dependent state in the same way as New Mexico. Everything is not riding on oil here. We're not quite as attached to those kinds of commodity market changes. So I think state policymakers see that, if people are still out buying groceries, if people are still out, shopping, whether that's online or elsewhere, that maybe we're not going to take quite as big a hit as we would have feared if everything had just, if maybe the shutdown had been much stricter or much more protracted.
Right. Well, thank you, Andrew. We certainly miss you reporting on New Mexico, so it's really nice to have you on the show this week.
Good to see you again.